We have an incredible support team, which I will give you the link to in case you have any difficulties. Of course, the people who have difficulties aren't here. You're all here. But if there's any difficulties during the summit, please reach out. Welcome. And I think we will, it's 8:30, we will begin. Lauren, I'm so glad you're joining us. Lauren already accessed that technical resources. We're so glad you're here. Dr. Paul Charlton, please, our chairman of the board of Healthy Climate New Mexico.
Good morning, everybody. Thank you for joining us here for our Extreme Heat Health and Resiliency Summit. It is an honor to be able to host this for our state of New Mexico and for all of our friends and colleagues who have joined from other places. My name is Paul Charlton. I am an emergency medicine physician. I live and work in Gallup, New Mexico. And I also am the board chair of the Healthy Climate New Mexico organization. Talk about a timely topic for us to be hosting a summit on. We, as I think people are aware, we're seeing nearly coast-to-coast heat warnings throughout our country. Records, again, broken, many places reporting up to 30 degrees Fahrenheit above historical averages. We're seeing deaths in cities and counties across the country, seeing places like Houston that just suffered a hurricane, prolonged electrical grid failure, and now on top of that, dealing with heat events. This is a very appropriate topic for us to be talking about in the state of New Mexico. So thank you all so much for joining today. We will be having, for the summit, we will be running until about 12:30. We'll talk a little bit more in a second about the logistics. We would like to encourage people to turn on your videos if you have a chance so that the speakers and others can see all of our community that has joined today. I would like to briefly introduce Healthy Climate New Mexico in terms of our organization. We are a relatively young organization who was created just over a year ago. And we are, Kelsey, would you mind going to the next slide for this? So we are health professionals based in New Mexico, working for New Mexico to try to help our state, our communities, our families, our patients have a healthy, equitable, sustainable future. This is a public good organization. We are recognizing what the science, the applied science, and what are the stories that we're seeing in our actual experiences in the clinics and the public health realm that we work in are telling us that this is a very important health issue. We approach our work here through a health lens and are engaged on a number of different fronts to mobilize New Mexico health professionals, whether those people are healthcare providers or public health professionals, mobilizing to advocate for climate solutions that protect health and promote equity. We have activities in a number of different realms, and that includes education, such as what we are doing today. We also work with policymakers and other legislators, other regulatory bodies around educating people from a health lens about what we are seeing and what New Mexico is facing more broadly. We work with, so we work on advocacy, policy advisories. We recently had a health advisory that came out and a wildfire smoke policy. All of these things are emerging ground up based on what we are seeing in our communities and in our clinics. We have been engaged with rulemaking in the state and then education and presentations throughout many different levels. While we are New Mexico focused, we are linked in with, as a state affiliate of the Medical Society Consortium for Climate and Health. where we are taking what we're seeing happening around the rest of the country, the innovations that we know that New Mexico needs to be as prepared as possible for the challenges that we're facing, and trying to make sure that New Mexico has access to benefit from those. We really would invite everybody to join if you are concerned about what's happening in our communities and in our state. This is open again to volunteers from all different backgrounds who identify as health professionals. We are a nonpartisan organization working for the good of New Mexico, and it's been a very exciting time. I think for many of us who are looking with clear eyes at the challenges that we are facing in the realm of the health impacts from climate, one of the things that comes after we recognize just how daunting these challenges are is that one of the best ways to avoid paralysis and despair is to be engaged. And so we do welcome everybody to become part of the movement to try to make New Mexico as livable, as healthy, and as wonderful a place as it can continue to be going in the future. Kelsey, could you go to the next slide? Healthy Climate New Mexico would like to acknowledge our commitment to care for this land and our responsibility to all peoples, including our indigenous pueblos, our tribes and nations who have lived here in the past, now, and in the future. And we as an organization are exploring how to best communicate and act on this commitment as we grow and mature. I would like to thank everybody from Healthy Climate New Mexico with the planning committee and the volunteers, including all of our Healthy Climate New Mexico hosts, who will be playing different roles in the summit today, the support team and staff, our members, our speakers, and then all of you, our attendees. We had over 280 people register for the summit, just showing just how much people in New Mexico care about this and how important the issues are. I would like to give a special thank you to all of our sponsors as well. And this has made a huge difference in being able to bring this all together. We have speakers that are nationally or internationally recognized leaders, and it is a tremendous opportunity to be able to have everybody joining here today. So a huge thank you to all of the sponsors who have made this summit possible. And I would like to introduce my colleague, Dr. Claudia Protesi, PhD. She is the chair-elect of the Healthy Climate New Mexico Board and an assistant professor of the UNM College of Population Health. And she will go over the summit logistics, the goals, agenda, and introduce our first presenters. Claudia, I'll turn it to you.
Hello, everyone. Good morning. Thank you so much for being here. First and foremost, tech support, if you have any issue at all, please let us know. This is in our chat, info@healthyclimate.org. Send us an email or text message, and we will help you get back online. There is a person that is there waiting anxiously to help you. Next. Also, we do have interpretation in Spanish. If you don't see the little globe, there is also on the far right a little globe that says more. It's in there. So click on there if you need interpretation in Spanish. And I would like to introduce our Spanish interpreter, Isla Garcia. Isla, could you introduce yourself? Oh, Isla, are you muted? We can't hear you.
Isela?
Isela, I'm sorry, I mispronounced her name too. Could you introduce yourself? We still can't hear you. Do we know why we can't hear her? Because she's not muted.
Not sure why. I wonder if Isela's already speaking through the Spanish interpretation channel.
That could be it.
So perhaps.
Yeah, someone indicated that in the chat.
Thank you. So Kelsey,
Okay, perfect.
would you be, Kelsey, I don't know if somebody would be comfortable just briefly saying how to get interpretation, or we have a note in the chat as well. Great.
Okay, so let's move on. So our goals, we want to understand the health impact of heat and take action and reduce harm in New Mexico. This is super important. So the objectives are increase knowledge about worsening health impacts of heat, including data, trends, and risks. Identify ways to reduce harms associated with extreme heat. Commit to taking action to reduce heat-related harm in our community, homes, and workplace, and describe one way we can advocate for systematic action to reduce the trends of extreme heat for the most vulnerable communities in New Mexico. This is very important for our state. Next. So these are the sessions we will be having. So we have the heat and health impacts in New Mexico. At 9:15, understanding the impacts of heat on health and equity, substance disorder. And then we do have a break at 10:15, from 10:15 to 10:30. So you have a little break, go get your coffee, and then come back at 10:30 for solutions to reduce heat-related health harm. The individual to the systematic. Then we have our breakout sessions at 11:15, and then at 12:10, heat advocacy and action, which is very important. So don't go away before we talk about advocacy and action. Next. If you are here if you would like to have, well, first, feedback is very important to us, so please stay and give us an evaluation. And if you are here for continuing education, the summit is approved for 3.5 contact hours for nurses, social workers, community health workers, and certified health education specialists. So when you leave the summit, fill out a brief evaluation. The link is in our chat, and it will continue to be posted in the chat, so it's always there. You can easily find it. For CE credits, you must complete the evaluation and the sessions you attended. Note that there is a separate evaluation for nurses who want contact hours that must be completed. We will post the evaluation links at the end of each session. So if you have to leave early, which you don't have to, you can do that. So stick around. Next. So before our first speaker, we would like to get a quick sense of who is in the room, what kind of work you do, where you're from. So could you please answer a few questions? So here's a quick poll that will be posted by our beautiful Kelsey. There it is. Scroll down because there are more questions coming. Are these already the results? Okay, the results are popping in. Okay, we still have a few people answering, but we're almost done. Okay, so 4% physicians, We have practice providers, nurses, we have public health, a lot of public health people here, social workers. We have some others, and then here are the regions people are coming in from. So welcome everyone. This is great. It's so nice that you are all here. And thank you for, was everybody able to see the results? Okay. I think we have